What are some of the considerations that will be important for community physicians that are different than hospital line physicians?
There's a Danish proverb that says predictions are difficult, especially when it comes to the future. But with that, I would say that it's a safe bet to predict that more and more physicians will realize at the end of those open-ended conversations that they don't have everything that it's going to be necessary to meet these new ways of doing things and these new reporting requirements. So with that in mind, I would predict that the run toward alignment is going to be great. I really do. And I would remember, though, that those who are currently still independent remain independent for some very real reasons. One of them, they're probably pretty skeptical about working with hospitals. They just are. That's just real. Two, they strongly value autonomy in the way that they practice medicine. So going in with sensitivity, not only is their payment profile change, but now I'm going to have to work with you guys. That's a real challenge, but it's a good one. It's the right thing for us to be able to do this for our patients. But having the recognition and having that at top of mind as you approach the community physicians, I think is going to be very important as they run to partner with you out of necessity.
I think another opportunity for community physicians is to be aware of the resources that are available out there. For example, their professional societies. There's a host of information available through many, if not most, of the professional societies already about MACRA. And organizations such as their local medical society, their local hospital association, and the CMS website itself offer the opportunity for physicians to consider how integrally involved they want to become with a much larger group, such as a hospital or another group of physicians. It may be that they can identify enough resources, both within their professional societies and such, and also within their own existing office staff, to be able to accomplish much of this on their own. And with that said, I think it's really important to identify what the strengths are of the staff that you have right in your own practice. Oftentimes, we find that staff who are given a full understanding of the implications, not just a financial implication or the importance of filling out a spreadsheet or getting some small piece of work done, but the impact on a patient, what it means to be able to save a patient's vision or a patient's limbs by improving the control of their diabetes, for example. That's something that we innately know as physicians. We learned it in medical school and training. And the people who we ask to help us track and trend the improvements that could lead to those positive outcomes don't necessarily know that. So instead of understanding that it's important to know what someone's A1C is so that we can hit a particular target, if they understand that the ultimate goal is to save that person's vision, that can really open the door for tremendously creative people to be able to come up with better ways to accomplish that with even with a limited set of resources.